This morning on Today's Consumer, making sense of health insurance when there are so many different kinds, from private insurance to the marketplace and Medicare for seniors. How do you choose the plan that's right for you? Here with everything you need to know, NBC News senior business correspondent Christine Romans. Christine, good morning.
Good morning.
All right, you're going to break down this so confusing world for us. I mean, most people get their insurance from their employers, but for folks who work for themselves, who don't have access to that, what are the options?
So you're going to go to healthcare.gov, and that's the Obamacare set up through the Affordable Care Act, and that's one place you can go. Or it's going to be Medicare or Medicaid, depending on your age and your income. So those are the public places to get your health insurance. About 54% get it through work. The rest of people have to go get it there. So there are those public options, and you also always want to check whatever your insurer is. Check with your insurer to make sure the doctor you're going to is covered by the insurance, because that's going to keep your costs down.
Yeah, speaking of those costs, I mean, in-network, out-of-network now, there's these concierge services. I mean, what are the costs involved here?
So three major costs to think about here. Your premiums, that's your monthly bill. That's what you pay every month for the right to that insurance program. Your copay, that's your out-of-pocket cost. Take your kid in for maybe, a sore throat, it's going to be $20, right? So that's your copay, and it depends on what your insurance is. And then you got your deductible. That's how much you have to shell out before the insurance actually kicks in. It can be like $2,000. So at the beginning of the year, you might notice, hey, wait a minute, it costs more to go to the doctor at the beginning of the year than later, because you have to meet that deductible. And then there are out-of-pocket maximums, which is really important for people with a chronic illness. At some point, say $10,000. Insurance kicks in 100% so that you are not going to be bankrupted by some of those bills. Again, check your policy, and always check again for out-of-network coverage. Sometimes a specialist you want to see is not in your insurance network. It's going to cost more.
Oh, yeah. You don't realize it until after you're a specialist. This may sound like a silly question, but I've always wondered, why are our teeth and why are our eyes treated with an entirely different plan?
Those are separate plans, and they're really important because your teeth and your eyes can be indicators of your overall health.
Right.
You don't want to scrimp on this. Did you know that barbershops were where you got dental health for a long, long time before it went mainstream, right? So these policies are still a little bit, so you don't have to go to the barber to get your teeth. Go to the dentist. These are separate policies. They can be pretty inexpensive in many cases, but often they have a higher deductible. So for dental, they average about $47 a month. For vision, about $5 to $30 a month.
All right, the big cost when you talk about prescriptions.
Yeah.
How are we going to find the cheapest way to get those?
Prescription costs are really important here. Again, if you have a chronic illness, this can be a problem. So most insurers cover prescriptions, but talk to your doctor. If he prescribes or she prescribes something that's not on the formulary, that's the list that your insurance cover of all the medications that it will cover, maybe the doctor will write a different prescription. Also, talk to the insurance company, right? And you can make a case that you need your medicine covered here. But again, it's all about communication, I think, because a lot of people are confused and are intimidated by all of this insurance talk and insurance coverage talk, but you really need to be talking to your doctor and your insurer to make sure that you're getting the best deals.
What about those websites you see that, like compare prices or give you coupons?
Yes, coupons are really important. And, the manufacturers will give them, too. You can go to a manufacturer and find out the drug that you're on if you can get a coupon that you can use at the pharmacy. So there's also there's a couple of GoodRx and RX Saver. There are some different websites that you can go and shop around. I mean, you kind of have to spend the time and do the research. That's the sad part about it, to get a little bit of extra money. But there is money, and there are incentives out there.
Before you leave this morning, we talked so much about mental health on this show, and I think a lot of people assume that they just can't afford it.
Yeah.
Is there any way to get that covered?
So private insurance, check and see if you have it covered. But if you have public insurance, so Obamacare, Medicare, you have coverage for these issues, for mental health issues and substance abuse. So research what is available to you. A lot of times therapists, they don't accept insurance up front, so you have to pay out of your pocket. This can be a hurdle, but you pay out of your pocket and then you submit to your insurer for coverage. So that's really important to do. And again, it's always good to have an advocate. To talk about the conversation you were just having with Dr. Natalie, have an advocate on these issues who can help you with some of maybe the more tedious parts of getting stuff covered. Because if that insurance benefit is there, you definitely want to use it. Yeah.
It's great tips.
Very helpful. Thank you so much.
You're welcome.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.